You don't have to agree with these events to notice something deeper is happening. In just the past few weeks, nurses and medical professionals have been in the headlines, not always for care, but for controversy. So here's the real question. Do you believe medicine is still neutral, or is something changing? Several nurses have protested or taken to social media to express their political views, but this isn't about politics. It's about trust. Recently, stories involving nurses, from strong public reactions to legal cases and emotionally charged headlines, have drawn attention with suggestions on how to medically get rid of federal agents. Each story is different facts, different outcomes. But when the same profession repeatedly shows up in high-emotion coverage, people begin to ask a different question. Not who's right, but what's going on. For example, recent footage from Minneapolis shows an intensive care nurse, Alex Preddy, in a confrontation with federal agents during a protest. A video from January 13th captures him engaging with agents, and at one point appearing to spit toward and kick at a government vehicle before officers grabbed him and briefly restrained him. That encounter occurred just days before he was later killed by federal officers in a separate incident, a moment that sparked national debate about federal enforcement, public safety, and professional roles. The point here isn't the specifics of any one action, but how a nurse, Alex Preddy, had taken an oath to abstain from whatever is deleterious and mischievous, and to dedicate himself to the devoted service of human welfare. Yet, in this footage, a nurse appears in a high-tension protest scene. The question isn't about one individual's choices. It's about how public perception can shift when professionals sworn to serve are caught in unexpected contexts. There's a term experts sometimes use for this kind of shift in how people view a profession. It's called ideological capture, when a field meant to stay neutral slowly becomes associated with social or political ideas. And when that happens, public trust can erode, even if most professionals are still doing their jobs with integrity. To be clear, the vast majority of nurses and healthcare workers are dedicated, ethical, and focused on patients. But healthcare depends on something fragile: trust. Once people feel uncertainty about motives, neutrality, or values, that trust becomes harder to maintain. This isn't about left or right. It's about whether patients feel safe and confident when they need care most. And as medicine remains a space where treatment comes before ideology. So let us ask you not what you believe, but what you've noticed. This video isn't about attacking nurses or healthcare workers. It's about public trust, professional neutrality, and patterns people are noticing, whether they agree or not. Thoughtful discussion is welcome. Personal attacks are not. What have you noticed? Do you feel something is changing in medicine, or do you think the headlines are misleading? Drop a comment and subscribe. See you on the next video.